the World Health Organization released a list when the vaccine was rolled out of potential serious harm from the vaccine, these mRNA products, which basically involved every organ system in the body. Heart attacks, heart failure, rhythm disturbances, myocarditis, stroke, and the worst one, the most concerning for me, I think for long term, is cancer. I'm not doing this for scaremongering now, Peter. It's, in my view, it is, mad would be the politest way to describe the fact that this has not been pulled from the market already and there isn't a serious investigation going on and we're not doing something to help the vaccine injured and to help protect other people who may be asymptomatic now that are at risk of problems in the future. I think another way to describe it would be criminal. It's beyond comprehension. I wake up every day thinking this is a living nightmare.
Right, afternoon. Aseem, how are you?
I'm all right, mate. It's good to see you.
Yeah, interesting that I get to talk to you a couple of hours after a quite significant law has passed. I don't know within your circles. This has been discussed, the assisted dying. I don't know how much you think about it.
Yeah, so it's interesting, actually. I haven't been paying much attention to this particular issue at this time because I'm focusing on lots of other things right now that's taking up all my attention. But interestingly, it's the one person that was who heavily campaigned and influenced BMA policy over a number of years on this issue of assisted dying was my father. Okay. My father, who was deputy, one stage was deputy chairman of the British Medical Association. He was honorary vice president. He got the Labour Party National Doctor of the Year award, considered probably the most prolific campaigner for saving the NHS and sustaining its values more than anybody in the last 3 decades. Just to give you background here. Mm-hmm. All right. And he was actually very much for assisted dying. Okay. But of course, there are so many nuances here. And I personally think as well that there should definitely be in certain circumstances, I think that it absolutely is not an unreasonable thing. You know, certain people with terminal conditions who are suffering. And I've seen that very much up close myself. And I have worked in, palliation of patients who are dying of cancer, for example. I have administered morphine to patients. I've seen things up close when they're suffering. So, everyone has a different opinion on it, but I think there definitely should be the case for people to be allowed to have that wish.
Yeah, I think my only thoughts was it feels like it's suddenly come around very quickly, and I don't feel like I've seen too much debate on it. I've watched my mother pass away from cancer. Luckily, hers wasn't too painful towards the end, but I've watched her suffer, and I wouldn't want anyone to suffer. And also, I think if you're pro-freedom, you have to be pro the idea people could do this. Yeah. But I don't understand enough about it. Yeah,
I think the problem is, and I think where the debate is happening is about where it gets misused or abused. And maybe there are situations, for example, that somebody has, say, severe depression, which is treatable and reversible. And all of those lines have not been exhausted. I'm just being hypothetical here, where somebody then ends up, dying prematurely unnecessarily when they could have been fixed. So I think that's where, but I think every case is unique, and I don't think it's going to be a blanket. I think people are worried that, and of course, I'm not. There are some quite, how should I put it, fanciful opinions out there that this is another way to kill old people, and I don't think that's true. I honestly don't think that's true.
I think if anything, it's. I don't have a huge objection to the idea of assisted dying. Again, I think people should be able to choose. I worry about the state's involvement in assisted dying because I worry about government, probably because of one of the main things I want to talk to you about, really. I know you've talked about it endlessly, and you might be bored of talking about. No, I think it's a few years ago. Right, I was walking. I specifically remember exactly where I was when I listened to your interview with Joe Rogan. I was walking down Miami Beach, and I was at a time reflecting on how I got a lot wrong, and I'd been vaccinated, And I had a huge amount of regret from that. Huge amount. I felt I'd been conned, actually.
Join the club.
Yeah. Well, but you were in some ways also kind of persecuted a little bit, as I remember the conversation.
Just a little.
Just a little bit. Yeah, quite significantly. Do you mind going back and unpacking that? Because I think there's people like me I was initially pro-lockdown.
Yeah.
And then I wasn't. I got vaccinated and then I regretted it. And I know there's a lot of people like me who feel like that, but the conversation's gone away and they don't know how to feel now.
Yeah, sure. And actually, I think we should also, it's very interesting, the point you raised about role of government and the state. We should definitely discuss that further. I think it needs a lot. It needs a much broader, wider discussion than kind of this nanny state stuff versus freedom, etc. I think things are getting a little bit confusing for people and have become too binary. We need to talk about what we expect of our government, and also, society cannot function without a strong, effective government that does its duty primarily for the public. These things have been distorted. Because without government, let's just say the other extreme, I'm going to come back to the pandemic stuff. Without government, you've basically got anarchy and chaos.
Which, by the way, some people want. I know a lot of people who want.
No, but I mean, literally, you've got lawlessness, you've got all sorts of stuff going on, people committing murder and stuff and getting away with it. I mean, you've got to just say, okay, what do we expect of government? And of course, government are there to, one of their primary roles is to pass laws and legislation that is in the public good and is good for society. And that's where discussions and debate needs to happen. So we start from there and then we can, take things further. But we do need government, and we do need government for laws. Without laws, again, it's a complete chaos.
Yeah. So,
but the problem is, I think, Peter, is the government is not fulfilling its duty and its role to the public, or certainly has not been for a long time across the world. And we can talk about the factors behind that. Of course, I focus very much on the corporate capture and corporate corruption. But no, let's going back to the beginning of the pandemic. Where do we start?
Well, I tell you, a good place to start would be is knowing what you know now. How real and serious was COVID? Because depending on where your news source is or who you believe, COVID was very dangerous for some people to be nothing more than a mild flu to other people. So you, as a doctor, I'd probably respect your opinion more on this.
Sure. Yeah, and I also probably have quite a unique perspective on this. Certainly, we'll start with COVID, and then we can move on to the other issues. Early 2020 is when, the news starts breaking around the world of this so-called deadly pandemic. I was watching it very, very carefully, looking at some of the initial data that was coming out, that was very clear that this seemed to be a virus that was particularly deadly in the early stages for older, vulnerable people. And just to give an example, even during the first wave, which we now know probably was the worst wave. I mean, there's some debate about whether the Delta variant was worse, but that's just, in keeping with the principles that viruses tend to evolve and become less deadly with time. The first wave of the so-called pandemic was probably the most deadly. And in that wave, in Italy, for example, the average age of death was 81. And the average number of comorbidities, as in chronic conditions, related to those people that died at the age of 81 was 2.7. Similar figures coming from China. And I was actually, I think, the first public voice, certainly the first doctor in the world, actually, to go on Sky News I think it was March 2020, to basically say that we've got this message of stay at home, protect the NHS and save lives when the lockdowns were imposed. But there's something missing here, because it seemed very clear that the people who are most vulnerable to dying from COVID, it was conditions linked to chronic disease and lifestyle, obesity, something called metabolic disease, very common, very prevalent, unfortunately, and affecting most of the population of America and certainly here as well. And I said, where's the message from the Prime Minister to eat real food? Now, it sounds kind of almost comical to say that, but actually that is the reality, that if we had a healthier population to start with, then we would have had less deaths. And that's been shown now that 90% of the deaths globally that happened from COVID happened in countries where more than half the population were overweight or obese. Now, the reason I'm mentioning that, Peter, to come back to answer your question, is in that process as well, it became easier to understand the infection fatality rate. And I actually wrote an article in European Scientist before I published an article, front page featured article in Telegraph. It became a big story where I'd linked Boris Johnson's hospital admission to his weight. And that became a big story. And I was on BBC and ITV and all that kind of stuff. Good Morning Britain talking about it. But I wrote this article saying, it was something like the elephant in the room around COVID and obesity. And the infection fatality rate, certainly in older people at the beginning, was several times worse than the flu. One estimate that was put together by John Ioannidis, who I call the Stephen Hawking of medicine at Stanford, who actually published one of the first papers early on to look at the infection fatality rate, looking at PCR test positive people from COVID in the community in Santa Clara in California. If you were a person over 70 in a nursing home, then the fatality rate from getting COVID was actually very high. It was about 5%. But it dropped quite rapidly once you were a healthy person under 70. And you're absolutely right. Now we know that it's certainly in the overwhelming majority of people under 70, the fatality rate from COVID was no different to the flu. So that is correct. But Jay Bhattacharya, who co-authored this paper with John Ioannidis, who you now know has been named as he's a very good friend of mine. I've known him for a few years, and we've been, allies together in this movement. He's now been nominated by Donald Trump to be the new head of the National Institutes of Health, essentially taking over from Fauci's role. It's a very, very important role. And I had conversations with Jay about this when I met him for the first time a few years ago in California. And he made the point that the infection fatality rate there was 1,000-fold difference between the highest risk people, the frail elderly, and children, to the point where actually for children, Peter, the infection fatality rate was actually less than the flu. Think about that. So there was a big range, and that's why he co-authored the Great Barrington Declaration with Sunetra Gupta and Martin Kulldorff, basically saying that from the beginning, this plan to lock down the whole of the world essentially was going to have an overall net negative effect, because it was going to affect children's education, which would have long-lasting legacy effects, which we're experiencing now in terms of their cognitive function, their mental state, level of attainment in terms of education, et cetera, is going to be delayed. All of these things have come true. The huge economic cost of businesses, that basically ceased to function because of lockdown. And he basically said, and he's right, that the only people that seem to be okay or potentially benefit from lockdown was the so-called laptop class, right? Mm-hmm. And that's really what happened. And I think that's proven to be true. So going back, absolutely, it should have been focused protection. Doesn't mean, let the virus rip through the world and kill people. It was, let people, we were never going to stop the spread of COVID. There were certain people out there. There was one academic in Edinburgh University, my alma mater, who basically, was very prominent in suggesting that we should adopt a zero COVID policy, that we can completely stop the spread, and that was never going to happen. From respiratory viruses, that you can never completely stop the spread. There was a delay, of course, in the spread, and there was maybe a delay in one of the arguments put forward, which I get from our government and our medical bodies, was that if we have the lockdown, we delay the peak incidence of infection happening quickly in the population, which would then reduce stress on the NHS. And NHS was already overstretched. Mm-hmm. And overstretched because stuff I've campaigned on for over a decade is we've not dealt with the root cause of the chronic disease pandemic.
Yeah,
right?
and there's
so there's so many different layers to this. But to answer your question more specifically, absolutely, I think we got this very wrong. We should not have locked down. We should have been much more nuanced in our approach. We didn't utilize other means of protecting people in terms of, giving advice on diet, making sure people's vitamin D levels were optimized. Things that don't take a long time to improve, enhance your immune system or normalize it or whatever you want to call it. So these things were missed. We know that a lot of the deaths at the beginning were so-called iatrogenic, caused by wrong treatments and wrong approaches. For example, ventilating people, right, who didn't need ventilation, purely based upon oxygen levels, not based upon actually their state of consciousness. So there were so many things we got very, very wrong. I think the other issue as well, Peter, is the diagnosis of COVID. I think the numbers have been grossly inflated as well. Because if you died within 28 days of a positive test, that went down as a COVID death.
Yeah, whatever the cause of death.
Whatever the cause of death. And as someone who has worked in hospital medicine for, almost 2 decades, on the front line, worked in A&E, worked in cardiology care, viruses are quite common in hospitals, and they absolutely can play an influence and make you a bit more sick. But, I think that was that would have massively exaggerated the fear or the death rate from COVID and therefore the fear of COVID. And we now know, Peter, I mean, this is another thing that emerged, in the last few years, was the secret WhatsApp messages.
Well, there were more released today.
Yesterday by Isabel Oakeshott.
Yeah.
I was privy. She actually asked me, I don't know who else she asked, not many people, but just myself to look at it beforehand, the one she was going to publish, to ask me my opinion. But previously, she published some WhatsApp messages which made front page of the Telegraph newspaper, where Matt Hancock, Secretary for Health's plan early on in the pandemic was, in quotes, to frighten the pants of the public so they would be compliant. That's not healthy. And the hospital admission rate on average, even in older people for COVID, if you got COVID early on was probably around the 1% figure in the worst phase, right? Less than 1% for obviously younger people, way less than 1%. But one survey in the United States revealed that, 50% of Americans surveyed felt, and this is obviously what the information they received from the media, that if they got COVID, their risk of being hospitalized was between 30 and 50%, almost 1 in 2. So without understanding these numbers, which are really important, the public are vulnerable to exploitation of their hopes and fears by political and commercial interests. So for me, I like to look at things analytically and rationally, right? And you can actually explain most of what happened based upon, psychological fears that were promoted and pushed and exacerbated by governments. But actually, ultimately, who benefited? Big Pharma, big corporations, big tech, certainly from lockdowns. They benefited massively because of the use of, digital communication increased.
Zoom.
Right?
Yeah.
And I can't remember the figures, but I know the likes of Zuckerberg and stuff, they made hundreds of millions, if not more, from lockdown. So
they were incentivized to censor different opinions?
Yeah, and I don't think it started from that. I don't think there was this so-called plan. Now, listen, conspiracies sometimes come true, but most of the time, these are mistakes and cock-ups that are then exploited by people who want to make money.
Okay.
And I think that's the best way to sum up what happened in the pandemic.
Panic, followed by incompetence, followed by commercial opportunity. Yeah.
And on that note, by the way, just very interestingly, I befriended a well-known Chinese broadcast journalist during 2020. And I think it was even as late on as 2022 or 2023, there were these images coming through from China when we knew it was now Omicron, we'd stopped lockdowns, where there was another wave of Omicron, which was very mild. It was basically a bad cold. And there were all these sort of Chinese officials, walking around in hazmat suits. And I messaged her and I said, what the hell's going on? And she said, Aseem, you've got to understand, most of the Chinese people still treat or think COVID is like Ebola, touch it and you die. And this came from also a panic that would have happened within, I suspect, the Chinese government. They're human beings as well. So there was almost like this strange, self-reinforcing fear that occurred even amongst people in these very high-ranked positions that then got fueled by the media, and then it became a vicious circle. So I think that even people in government had a much exaggerated fear, a lot of them, of COVID.
Yeah, look,
even the people making these policies were actually, had a fear that was just, again, fueled by media.
The humble bee, a keystone species crucial to the survival of Earth's inhabitants. Here's how things would look if bees vanished. And here's how they'd look if humans vanished. But imagine if instead we became a keystone species by doing things the right way, by taking responsibility for our actions and becoming the solution. Iron mines the world's most responsible currency the right way. Because the future depends on it.
Well, I mean, look, I understand the early fear. 2 days before Boris announced the lockdown, I went out to Turkey to a refugee camp on the border with Greece to film the, as Erdogan was trying to release the refugees, trying to evict them out of the country. I went out there to film, and on the way back, I got really sick to the point I assumed I had COVID. They wouldn't test me because I hadn't been, because you remember in the early days, they only tested you if you've been to Italy, China, there were certain countries. They wouldn't test me, but I was pretty sick. And I also interviewed a friend who's a doctor at which hospital? Is it St. James's? Hospital?
Okay.
Yeah. And he said they'd gone from a trickle to a flow to declare an emergency within 24 hours. And then I watched the Sky News report in Italy. I was like, okay, this is serious. I understood the lockdown. I understood the panic, but I didn't have any data. The people within the government who were making the decisions must have started to have access to the data that you had access to. What I don't understand is why that data wasn't acted upon. What were the reasons to not reconsider these policies if the data was showing exactly what you said?
Yeah, so I don't know whether they may have been looking at different data.
Okay.
I think there was this evolution of the problem. To be perfectly honest, if you remember at the very beginning, Boris Johnson actually said we're not going to lock down.
Mm-hmm.
I think he even said let it rip, didn't he? Anyway, whether I'm misquoting him, but there was that kind of approach to it. And the World Health Organization also said the lockdowns don't work for respiratory viruses and there's no, good reason to do this. For whatever reason, the chaos and the fear that occurred in China, which is thought to be now where the origins of the virus came from. Originally, they made the story about wet markets, but we know it was human engineered. That's been established now, that it came from a lab, likely China, Wuhan, joint American-Chinese lab. It may well have been that they got privy to the fact that this was as a result of this so-called gain-of-function research, where these scientists mess around with viruses to try and get ahead of, or to see what may happen. And they do it mainly for fun, by the way. That's the strangest part. Scientists like to mess around with stuff. They're geeks. That's actually when I had a long chat with Jay Bhattacharya about this. And maybe because they were uncertain about some of the, not just the fatality rate, there were other issues going on as well, and maybe they thought actually the best way, long COVID we know about. I've managed patients with long COVID. So it was China who had this very, very strict lockdown policy, like military style, not like what we had, like proper military style, like people being policed, not leaving the house, right? And I think that the way China approached it, and also almost telling the world that we've contained it, I think then convinced the World Health Organization to change their tune and the rest of the world. That's probably what made a big difference, I'm sure.
But by the second lockdown, it didn't make any sense.
No.
I think by that point, I know most people I know were not paying attention to it or breaking the rules or...
Yeah.
and getting around it. So to then move forward to the vaccines, I spoke to my physician. He wasn't worried. He said, vaccine's fine. I got vaccinated because I wanted to go to Ireland to see my dad. I had no fear of the vaccine. I mean, I've had multiple vaccines in my life. I mocked people who were fearing the vaccine, which I hugely regret now. I'm totally embarrassed about it. And I massively regret getting vaccinated now because I worry, is there any long-term issue that I may face that I'm not aware of? There's a lot of fear-mongering out there that we don't know what's going to happen in 5 or 10 years. We could drop dead, could have long-term, cardiovascular issues. But before we get to that, you were also hugely suspicious of the vaccines themselves. Well, suspicious is probably underplaying it. You didn't believe people should get vaccinated. Is that correct?
No, it's not actually correct at all.
I thought you
no,
so I thought you spoke up against them.
Not initially. I actually had 2 doses of the vaccine myself.
Okay.
Right early on. Even though that I knew my risk was very low, I wasn't worried about it. I kind of did it essentially to appease my father, who was worried that I was going to get COVID and die. And
a doctor himself,
GP, retired GP. Part of that fear exacerbated was the fact that I think, we've had a lot of tragedy in my family. We'd lost my mum just a few years earlier. I lost my brother when I was young. I was the last surviving member of his family. And, we had arguments about it. And eventually I sort of succumbed and I thought, okay, well, having had many other vaccines, and of course as a doctor and working in environments where you're exposed to blood as well, there are certain vaccines I need to have. And I didn't expect it to cause any harm. I was dubious about the efficacy because vaccines for respiratory viruses generally are not very good.
Okay.
Certainly if you look at the flu vaccine, not particularly good vaccine. Not particularly effective.
Why do they issue it so widely? Because at my daughter's school...
Why do you think, Peter? We'll get there. We'll get there.
I don't want to get... But so we get an email out
it's
from
structural problems, not conspiracy. It's structural. And we'll come on to that. Come on to that. So I took 2 doses, and then one of the people that were asked me for my opinion, who was actually... So let's give some context here. Prior to the pandemic, I probably was the most recognized public voice, certainly doctor in the world, for over a decade, calling out, well, certainly for over a decade now, but going back probably about 10 years when the pandemic started, calling out the excesses and manipulations of Big Pharma. Okay? To the extent where... I've written about it in mainstream newspapers more than anybody. I, on 3 different occasions, called for public inquiries through different articles and news stories in the Daily Mail Online, BBC Radio 4 Today program, The Guardian, the newspaper, spoke in the European Parliament in 2019 and basically said we need a public inquiry and that Big Food and Big Pharma are killing for profit, essentially. But... despite that, I always put vaccines in a special place. I've never seen a vaccine injury, never heard of anyone with a vaccine injury. I've had vaccines myself. Couldn't conceive of it being a problem. So you've got to remember, and that's where most doctors were at, and many, if not most, are still at to some degree. Okay? So you've got to understand that mindset. So I had 2 doses. Convinced a friend of mine who actually was sending me stuff, which I considered just to be fanciful, strange blogs saying, and unfortunately, a lot of this, if you're going back to the very beginning, at the beginning of 2021, when there was a so-called vaccine hesitant or skeptical approach from certain sections of the population. Some of the stuff that was tied into all of that, unfortunately, was stuff that was really, in my view at the time, I still think so, ridiculous, like there are microchips in this.
Yeah.
Okay?
Yeah.
So because of that, I think it definitely made me think, hold on a minute, this doesn't add up, right, at all. I can't see any rational explanation of what's going on here. And did not treat it seriously and convinced my friend, the film director, Gurinder Chadha, to take the vaccine. She went on then and tweeted it out. And then Good Morning Britain, I've been on Good Morning Britain several times, although that's the last time I went on. And they asked, would I come on and help discuss and encourage people from ethnic minority communities who were reluctant to take the vaccine to take it. Now, Peter, before I go on that note, something else is very interesting that emerged. When you look at the people in general, you take averages and you look at different demographic groups. The people who were least likely to get vaccinated were people from lower socioeconomic backgrounds and lower educational status. And that included a lot of ethnic minorities. And if you look at religion, guess what the most vaccinated religion was in this country? Well, the highest uptake. See if you can guess. If I talk about educational attainment, 86%. And the least, guess who the least vaccinated were?
Muslims?
Yeah, about 36%.
Right.
Interesting, isn't it?
Yeah.
So, and so why is that? Well, some of the most marginalized members of society, either from low socioeconomic backgrounds or ethnic minority groups, or specific ethnic minority groups, let's not say all ethnic minority groups, are the ones that are going to trust government the least. They're being told what to do, they're going to do the opposite. That's one of the reasons, okay? So it's nothing to do with intelligence per se at all. And one could argue even the opposite, right? If you just look at the data, I'm not here to insult people, not at all. A lot of people use their intuition, and their intuition was correct. So I had 2 doses, went to Good Morning Britain. But again, for me, it was a bit nuanced. I was always very much, this should only really be for high risk or elderly people. At that stage, we weren't talking about mandates. We weren't talking about even extending the goalpost to low risk people. Remember, it was just for the role that happened at the beginning. It was only going to be for healthcare workers and for, older people, if you remember, Peter. That was what the narrative was, right? Yeah. So I was in that narrative. And then the situation changed for me quite quickly. Even as within a few months, I was seeing the goalpost change. I said, something's not right here. And then, I remember actually doing a tweet, which I later deleted because my father got upset with me before he had his unexpected sudden cardiac arrest in the summer of 2021, where I said something along the lines of, encouraging people, 18-year-olds and children, to have this vaccine is a crime against humanity. I put that tweet out. And my dad called me up straight away and said, you need to delete that tweet. You're going to get, So I deleted it. But just to say, this is what my mindset was already. And then he had an unexpected cardiac arrest and died. Didn't make any sense to me. There was also an ambulance delay that I exposed that became BBC headline news a few months later, that there was a government cover-up. That was in the newspaper. I wrote about that. I got contacted by someone in NHS England saying they'd covered up ambulance delay problems happening throughout the country for months. We wouldn't have called 999. The people with him would have taken to hospital. He'd still be alive. So, I've still not had an apology, by the way, from the Department of Health or Sajid Javid or NHS England. So they're still open to apologize to me for that cover-up and to all the people that they, that lost loved ones unnecessarily because they waited for an ambulance that wasn't going to turn up.
You covered that on Rogan, right? I remember.
I think I mentioned it on Rogan. But anyway, my dad's post-mortem findings didn't make sense. He had 2 severe narrowings of 3 of his coronary arteries. And then later on, data started to emerge where I was able to put it together and it became quite clear. And I've been diagnosing this myself with my patients, that what the vaccine does in certain people, sorry, it's not a vaccine, it's more of a gene therapy. It's not like traditional vaccines. By the way, Peter, how many vaccines do you know prior to this where you take it and you still get the infection? Almost certainly doesn't protect you from infection. Have you ever? I'm not familiar with any.
I'm not a vaccine expert.
No,
all
but
I know is I had a few as a kid, and then when I went out to Africa recently, I had 7.
Yeah, but you don't get the whole point is you don't actually get the infection.
Yeah.
And we were told, BBC, I think, said 90% protective, 95%. I mean,
but it kept dropping.
All lies.
Yeah, it kept dropping.
Complete lies.
Did it protect anyone?
So, okay, we'll come on to that. Certainly not from infection.
Yeah.
And even if it was a very small protection from infection, very tiny amount of people, It soon as the virus mutated, it then didn't protect anybody from infection and didn't protect anyone from transmission. In fact, actually, because of the nature of these sort of 2 doses that you get, there is good data suggesting it causes an immunosuppressive effect, and certainly for the first few weeks, and then if you have recurrent boosters, it probably increases your susceptibility. Think about that. How messed up is that in your susceptibility to catching COVID?
So it's completely useless.
It's worse than useless.
It's damaging.
It's worse than useless in my view.
Yeah.
Overall, net effect on society over time.
Okay.
But we can break down those numbers if you like. So yeah, that was the situation. And then, so if we want to break down the numbers, there's lots of information out there. It's confusing for people. Let's just take the most important numbers for people based upon the best evidence. So, rate of serious harm, published in the journal Vaccine, okay? It's not a blog somewhere, some opinion. Peer-reviewed journal Vaccine, reanalysis of Pfizer and Moderna's trials, which were the trials that led to the approval, so-called emergency use authorization of these products, revealed a serious adverse event rate, which was defined as life-changing, disability, or resulted in hospital admission. 1 in 800 at 2 months from the original trials, which are designed by the drug industry and therefore likely a gross underestimate even of the short-term harms, because they designed trials and choose people that are less likely to get side effects. But on average, it was 1 in 800.
Hold on. So they designed trials to get better data than they would get if it was random trial?
Yeah, to make it look better if it was independently.
But that sounds criminal. That's fraud.
Peter, it's called corporate capitalism. Have you heard of this?
Yeah, but it's also called fraud.
Well,
but look,
it is. Well, so fraud is deliberate. It's a very good point you make. Fraud obviously is deliberate deception in order to make money. And actually, you're right. If you actually broaden that definition, you are correct. But this is corporate capitalism. So the sooner people wake up to that, the sooner we can sort out the system that allows this to happen. And that's, by the way, and that's where you need government. You need government. No one else is going to change the law.
But we're not talking about. We're talking about people's health here.
Yep.
We're talking about things that will lead to people getting seriously injured or dying.
Why do you think I was so passionate to the point where on 3 times, and it's not something easy to do, as you know, to get articles in newspapers just like that willy-nilly. You have to have something very strong. You have to make a very strong argument. You have to have people supporting you. And I did it relentlessly from pretty much 2013 onwards.
And it's harder in this country with our libel laws. Much harder.
Maybe.
No, it is.
Maybe. But in America, it may be harder because Big Pharma has much more of a grip in America. 70% of the profits globally of Big Pharma are in the United States. America is pharma nation, literally.
Yeah.
Right? So yes, but maybe you're right. Yeah. Maybe you're right. And I was still able to do that without, I've still been quite successful in getting that message out. I mean, there was one situation that happened, although that was with the BMJ, where I exposed in 2013 that Diabetes UK were denying the harms of sugar, and yet were taking sponsorship money from a company that was basically marketing formula milk to 12-month-old babies that had 9 teaspoons of sugar in it, for example. Okay, and Diabetes UK actually initially sent a legal, but it didn't come to anything, based upon my investigation to the BMJ. So, yeah, coming back to this issue.
The data.
Okay, so 1 in 800 rate of serious adverse events, at least that. Those serious adverse events from the trial, 40% of the adverse events related to conditions involving clotting, lung clots, for example. Strokes, heart attacks would come into that. Blood disorders. But the World Health Organization, just to give people an idea of just how bad this product is. I'm not doing this for scaremongering now, Peter. It's, in my view, it is. There are different ways to describe it. Mad would be the politest way to describe the fact that this has not been pulled from the market already and there isn't a serious investigation going on and we're not doing something to help the vaccine injured and to help protect other people who may be asymptomatic now that are at risk of problems in the future. Okay, mad is probably the most polite way to describe it. I think another way to describe it would be criminal. But the World Health Organization released a list, endorsed a list when the vaccine was rolled out of potential serious harm from the vaccine, these mRNA products, which basically involved every organ system in the body. Heart attacks, heart failure, rhythm disturbances, myocarditis, stroke, neurological problems. I mean, every single organ system. So why is that? Because the injection that's supposed to keep the so-called spike protein in the arm and generate antibodies and not cause a problem, which then goes throughout your body and then is otherwise benign, that gets distributed throughout the body, the so-called damaging part of the virus, if you like, and goes in every organ system, every organ, in those tissues, and is either directly toxic or causes an autoimmune reaction. And that we know can actually stay there for several months and start problems and start a reaction that may then cause a problem later on or may cause a problem acutely. One review of people that died within a few weeks of having the vaccine revealed 74% of those cases was confirmed likely causal because of the vaccine from autopsies. It's a mess. It's beyond comprehension. I wake up every day thinking this is a living nightmare, knowing that people are walking around who are now unwittingly at increased risk of lots of health problems. And the worst one, the most concerning for me, I think for long term, is cancer. And this isn't my view. This comes from the preeminent oncologist and immunologist, Professor Angus Dalgleish from St. George's Hospital, emeritus professor, also now confirmed and supported by one of his colleagues who I would call one of the most eminent immunologists in the world. And both of these chaps are involved in vaccine development as well. Robert Clancy in Australia. So, yeah.
But I've seen... So
I haven't mentioned the benefits yet, though. Sorry. Should we just
yeah. Well, no, just one question on that, because you obviously are highly concerned about this. It sounds like we need some kind of open, transparent public inquiry into what has happened, but also to cover the present and the future.
Yes.
But I've also... What about the mRNA technology itself? Because it's referred to as a technology, and I've seen it being discussed with regards to vaccines for cancers. So as a technology itself, should it just be written off?
I honestly don't know the answer to that question, to be honest. I think we'll cross that bridge if and when we come to it. The first thing is it needs to be looked into properly now and stopped.
Okay. Are people still being given vaccines?
Yeah. One of my closest friends, her grandmother was hospitalized just about 2 weeks ago, a week after having a booster, which she tried and implored her not to have.
Okay.
People are getting text messages still from their GP practice to have this. It is...
But some have been pulled
as
well.
It's one of the things that we will look back in 5 or 10 years from now and think, what the hell did we do?
Well, I'm thinking that right now. I've been thinking that the whole build up to talking to you.
Yeah. But can I just finish on the benefit side, just so people have an understanding? Now, there are some people that argue there is no benefit at all. And we've had these figures touted, by the way, 20 million lives saved, according to World Health Organization or whatever. Yeah. Okay. I'm also somebody, as well as being a practicing cardiologist, I also have a special interest in evidence-based medicine, in particular, a very controversial speciality or area of interest, ethical evidence-based medicine.
Crazy, man.
Peter, yeah. Completely like,
what are you doing?
Totally. And I had for 5 years, I had a title of being visiting professor of evidence-based medicine in one of the most, prestigious medical institutions in South America and Brazil. So I've got probably a little bit more expertise than most doctors. I'm not the preeminent expert in evidence-based medicine. I would definitely defer to the likes of Carl Hennigan at University of Oxford, who I know, and likes of John Ioannidis. But one of the most important ways of communicating medical information is use of absolute risk reduction, which or absolute benefits or absolute harm. So I've given you the absolute harm of 1 in 800. In terms of the benefit in preventing hospitalization, UKHSA released data at the beginning of 2023. I think this is the first government in the world to do this. And they actually did what we call age-matched controls of vaccinated versus unvaccinated to give you a rough idea. There are lots of caveats still. And I think this is still an exaggeration of the benefit of having 2 doses of the vaccine, for example, and for people over 70 in preventing hospitalization. And that figure was 2,500, Peter. You had to vaccinate 2,500 people to prevent one person being hospitalized versus a serious harm rate of at least 1 in 800, at least.
Okay, so the math doesn't net out.
And then that figure gets worse as you get younger. You know, you're talking about, if you're under 40, you're talking about over 100,000 people need to be vaccinated, something like that. Or there and thereabouts. So it's a figure that, if it wasn't such a serious issue, would be laughable. You know, I have discussions with patients. I know, okay, fine, this is an acute serious illness, I get it, potentially. But I have discussions with patients all the time about statins. You know, these are one of the prescribed drugs globally, prescribed on the basis of reducing cardiovascular risk or preventing heart attacks. And most people prescribed statins aren't told that their benefit at best is 1 in 100 in preventing a non-fatal heart attack or stroke over a 5-year period without prolonging their life. And when patients are told that, most of them wouldn't take it.
Because the side effects are...
Well, that's even without discussing side effects. Okay. Because they're like, would you take a pill every day for your life if you were told that the lottery chances, a 1 in 100 chance is going to benefit you? Or, another way of looking at statistics, if you take this every day, it may extend your life by a few weeks.
Or are there alternatives?
Well, exactly. There's all of that to come in there, right? But basically, that's where the debate is. And we're talking about something that gives you a benefit of 1 in 2,500. Now, okay, you could make the case, if there was no harms at all, put it in the water supply, you know, treat billions and save God knows how many, you know, tens of thousands of people, hundreds of thousands of people, millions of people maybe. But that isn't the case, unfortunately. Far from it. So, and one other thing to add in, because I don't want to leave any stone unturned, and this has not been answered by the authorities. We have removed other vaccines from the market that have been found to be less harmful than this one. Swine flu vaccine, 1976, was pulled because it was found to cause Guillain-Barré syndrome, a neurological condition, debilitating neurological condition, in 1 in 100,000 people. Rotavirus vaccine pulled in 1999 because it was found to cause a form of bowel obstruction in kids that affected 1 in 10,000 people. This is 1 in 800 at least, and probably closer to 1 in 200 or 1 in 300. Some estimates suggest the death rate may be 1 in 1,000. You know, so what that means is, if you vaccinate 3 billion people, you're going to cause serious harm or death to 3 million people.
Very important that you don't lose this, okay? This is your inheritance through Bitcoin.
Let Bitcoin rip. Don't rip up your Bitcoin. Set up inheritance with Casa.
So are you and I walking around with...
Are we ticking bombs?
What risks are we carrying? Look, we're probably... You're probably a little bit more healthy than I am. You're certainly carrying less weight. But is there a risk we're carrying now? A known risk? I mean, I can't tell you about unknown risks because we don't know. But are there any known risks? Yeah, what are we, 3 years down the line since being
difficult
vaccinated?
to say, Peter. My concern is, yes, there is something there, but we need answers.
Okay. So
we need answers.
So we need public inquiry. We need research.
We do.
We need investigation. Because it feels like it kind of just got brushed on the carpet, just kind of went away. And everyone kind of stopped talking about it. But what you're talking about here is hugely important.
But we can't stop talking about it because we've still got this issue of excess deaths.
Yes.
We're hearing media reports now, these strokes that have gone up. We've got colon cancers in younger people going up, right? It's a mess right now.
But
It's a horror show.
Are there significant calls for a public inquiry into this?
There's definitely a growing minority of doctors and members of the public and healthcare professionals. We're just not getting an airing.
Do you think it's because too many people, a bit like I felt ashamed they got it so wrong, and they almost want to ignore it?
There's an element of that as well.
Yeah.
I mean, there are different stages. The first stage, though, is to understand what the problem is. So you can't get, if there's a psychological barrier, which is a big barrier to the truth for a lot of people, then they won't even get to the stage where they'd even potentially speak out. Only people who fully understand it are then in a position where they would speak out. But even those people, a lot of those people, Peter and I know them. Some of them are politicians, very famous politicians I won't name, who I had private conversations with, who I've met in Parliament, who basically are like, oh shit, but then are scared, right? Why are they scared? Because we are under a corporate tyranny. They're scared of Big Pharma. I've had people come up to me who have, one guy, I know I won't name him, he served like several years in jail, being initially convicted or accused of being a terrorist and then jumped ship. This guy comes up to me and says, Aseem, brother, what you're doing is way bigger than anything any of us have done. I'm thinking, Jesus, taking on this big mafia, Big Pharma. But I'm just a medium for a message, and there are a lot of people involved in this movement, and I think we are making progress, Peter. And I think we're at a tipping point now, and I believe that in the next few weeks, something's going to happen.
Oh, that soon?
So, yeah, it's too big now to be ignored, and there are too many people of prominence and eminence speaking out. It can't be ignored any longer. And those people are getting increasingly angry. They're not going to be shrinking violets. I'm not going to stop.
Talk to me more about Big Pharma. It feels like more of a problem in the US, like you've said. I always find it weird when I go over there, you put the TV on, every third advert is for some drug, for some condition I've never heard of, which then has this long, very fast-spoken warning at the end of every single side effect that you could possibly have. But it's advert for conditions I didn't even know existed. I don't feel it as much here. I feel like...
We're less medicated here, but
yeah,
it's still bad.
Medicated.
Still bad.
So it's still bad here.
I think the figure is something like 20% of people over the age of 65 are on at least 5 medications or something like that. And I think the majority of people over 50 are at least one now.
And the majority are unnecessary?
Yeah, completely. Well, the majority are not going to benefit.
Right.
So that's another discussion to have. So there's so many layers to this. Let's start with this sort of headline. Medical knowledge is under commercial control, but most doctors don't know that. So the information doctors get when they make decisions on the benefits and risks of drugs is curated by drug industry. One could say corrupted for the interests of making money. So that's when we get back to the design of the trial. So they sponsor these studies. They then design the study to give them the answer they want. They then misrepresent the results of those studies, in particular exaggerating the benefits, minimizing the harms, or hide the data on harms. And then the doctor uses information that has already been corrupted to then prescribe a drug to patients without even telling them that the absolute benefits and harms of the drug. It's very black and white. You've got high cholesterol, take a cholesterol-lowering pill. You've got high blood pressure, take a blood pressure pill.
Can I tell you my experience of this?
So do you see what I mean? So there's something missing also. They wouldn't be able to, unfortunately, Big Pharma wouldn't be able to commit these so-called crimes if it wasn't for the complicity of senior medical academics, if you like. Peter Wilmshurst, who's an eminent cardiologist, a whistleblower, he's got many awards during the years, Speaking Truth to Power. He was somebody that, in the 80s was involved in a drug trial involving a heart failure drug, and he was a principal investigator, and he found that half the patients were getting something called thrombocytopenia, the platelets were dropping. He reported it to the drug companies and wanted to stop the trial. They didn't allow him. And he then tried to expose it. They threatened to sue him, and eventually he won. But he says that, there's some really clear, important points to be made here. And this comes back to corporate capitalism, which I'm happy to discuss with you. Drug companies have a legal obligation to make profit for their shareholders. They do not have a legal requirement to give the best treatment. But the real scandals are that medical regulators fail to prevent misconduct by industry, and that doctors, academic institutions, and medical journals collude with industry for financial gain. If we take that bit further back,
But it's nuts. This is criminal.
Okay, well, so guess who is the brainchild behind this economic system that has produced this kind of law, this unjust, criminal, undemocratic, unethical law? That's what it is. This is a law, by the way.
I don't want to guess. I'll let you tell me.
Okay. Have you heard of Milton Friedman?
Of course.
Okay. Chicago economist, Nobel Prize winner, influenced Ronald Reagan and also Margaret Thatcher to deregulate industry.
You're gonna undo some of my libertarian leaning. Right?
No, that's fine, but it's okay that we've got to challenge our own beliefs and understand what's at the root of it all. But this is what, and to paraphrase, this is actually written about in a book called The Corporation, which you've got to watch. Mm-mm. The Corporation, it's a book and it's a documentary, and you can watch it on YouTube as well. It's free. Written by a guy that I know I've talked to a few times called Joel Buchanan, a law professor. And in that, he basically says that it is immoral for big corporations to put people ahead of profits. MBA students, when asked whether to remove a harmful drug from the market, will choose profits before the public, even despite being taught business ethics. So this is how we've got here. Now, Milton Friedman probably did it with the mindset of not thinking it was going to cause detrimental effect to human bodies, and probably didn't think about it in that way. Maybe he was thinking about other industries, and maybe that works best for them. But certainly doesn't work. But it doesn't make sense, does it? It's not ethical.
Can I tell you my experience? I just, about 12 years ago, I had a drug problem. And I had a cocaine-induced SVT. Went to hospital. I thought I was having a heart attack. You'll understand as a cardiologist, it's all the same symptoms. Stopped taking drugs immediately. Pretty much, I think maybe one more time I did, and I was done. But I had 3 SVTs in the space of probably 3 months. I also had regular panic attacks and chronic anxiety, all happening at once. And I went to the doctor because I didn't know what to do, and he prescribed me beta blockers and antidepressants. And I remember I got in the car afterwards, and I was like, "Wow, how the hell have I got here?" And so I just Googled alternatives. And it came up with running, yoga, meditation. And so I went straight down to JD Sports, bought a pair of trainers, went for my first run. I ran for pretty much a year, almost every day. Whenever I'd have a panic attack, I would meditate, and I would do yoga 2-3 times a week. And within a year, I'd got rid of all of it.
Amazing.
All gone. I've had... How many times have you taken me to the hospital in the last 5 years? 3. I've probably had three or four SVTs. But I don't know I think they might be, I feel something and I trigger it myself psychologically. But mainly I've cured it, and I've cured it without any medication.
Amazing.
And so that's made me highly suspicious of, here's a problem, doctor, here's a solution with a prescription. Yeah. I'm always thinking, is there an alternative? And so if that's just one incident for me, then when you say people over 65 are on 5 medications, or over 50 on 1, I'm automatically thinking, there's probably a majority of these, like you say, aren't needed, but have they looked at healthy lifestyle alternatives instead of these? They haven't, have they?
No. And it's partly because there's no money to be made from healthy lifestyle, really.
For me, that's obviously concerning. It's highly concerning. But how do you shift that entire model in industry? It almost feels like we need that kind of Trump moment here in the UK where we start putting the people in place to completely reverse the system. Completely.
Yeah, 100%. It's a false economy as well.
Yeah.
Because they're making money from fraud, in a way. You know, listen, I'm not an economist, but I'm interested in the economic system. And Adam Smith, who's considered the brainchild behind the free market, free market economics, said that markets function best on perfect information and relative equality. And we've got the opposite. So it's market failure. It's basically market failure. So it's a false economy. And, one of the issues that comes up when I've had conversations with people is that where we're going to get the money to fund, trials or regulators who are taking money from industry, et cetera, which is what will happen with this sort of Reaganomics.
But is that just gaslighting?
It was a way of kind of removing government spending, which is there for the public good if used properly, that money, and giving it to and giving services, public services, and selling them to big corporations, essentially, who are there just to make money. So they're not there for about quality. They're how do we maximize our profits? And how do we deceive people to think they're getting something that's good? So it's completely corrupted.
Yeah. And there's a link to the food industry, right? Because something I've been trying recently, so I've always been kind of overweight. I've always been kind of like 15, 16 stone. Only that time when I talked about running, I managed to get my weight down, but I've always struggled with it. Recently, I decided I was going to go carnivore for a while. And I've kind of mainly done carnivore, and my diet was pretty much for about 2-3 weeks, eggs and bacon for breakfast and a steak for dinner.
I'm curious. I've not done that myself. How was it for you?
Well, I lost a stone in weight in 3 weeks.
How did you feel?
Feel great. Great. More energy.
When you were doing it, you didn't feel lethargic or anything like that?
No, I felt the opposite. Yeah, I felt bacon eggs for breakfast would fill me till the evening, and have a steak on its own. And look, if we went out for dinner...
I'll have to try this one. I've not done this one yet.
Have some vegetables. But, but I've been made to worry that just a diet of with a lot of red meat itself is dangerous.
So you're also talking, there's a bit of bias here. You're talking to the guy that busted the myth of saturated fat and heart disease in 2013, the BMJ, and created world headlines. So the answer is no, it will not. In fact, it's not that there's no good evidence. There is good evidence to show that red meat does not cause heart disease. Red meat does not cause cancer, colon cancer. There is a link with nitrites, and specifically nitrosamines, which happen from processed red meat because of the preservatives.
Okay.
And they are carcinogenic, but the risk is still quite small in the sense that you have to basically, be eating processed bacon most days of the week for about 20 years, and that will give you a 1% chance of causing colon cancer.
Okay, so for my bacon and eggs every day for 20 years, I got a 1% chance.
Yeah, but you can have bacon that isn't processed.
Yeah, of course, yeah. Well, because I get it from the butcher now anyway.
Fine.
Yeah.
I wouldn't necessarily say that. I would say that it's neutral, and it can get your weight down. I would argue that there are better foods for health, but
listening.
But, but things like, okay, so I mean, the two biggest drivers of disease are something called insulin resistance and chronic inflammation. They overlap. And you want a diet that is, in one way, carnivore is good, actually, from that point of view, because it removes the starch and the sugar.
Yeah.
And that is a good thing. But it doesn't have necessarily anti-inflammatory components. I could be proved wrong, but the data that we have at the moment suggests that things like, lots of non-starchy vegetables, whole fruit, oily fish, extra virgin olive oil, nuts and seeds, these have a positive effect. So I would say that they probably have some protective effect from disease.
Well, I think the general...
So what I advocate for, and I've written books on it, and again, very open to new data, changing my view on this, but the best data that we know at the moment certainly from heart disease perspective, but that will cut across many other diseases, is what I call a low-carb Mediterranean diet.
Okay. Well, I'm trying to keep to single ingredient foods as they come from the butcher or from the vegetables or the fruits. And I'm trying to not have anything with ingredients. Not entirely there.
Great.
And I've also been going down the seed oil rabbit hole.
Yes.
Again, seen mixed reports.
Yeah, pro-inflammatory. There's no benefit of it at all. In fact, the seed oils are promoted on this, that they lower cholesterol, but lowering cholesterol is nonsense as well. Complete nonsense.
Okay. Because,
well, I've independently analyzed this with two other cardiologists and published in the BMJ Evidence-Based Medicine Journal to look at this. There was a dogma that we were indoctrinated with. As you lower your cholesterol, you get less heart attack, strokes, and death. And we found it was false. This is all, again, industry-sponsored nonsense. It's $1 trillion industry lowering cholesterol. And actually, high cholesterol seems to be protective against an early death, certainly in older people, because it's really important for the immune system. I know, this is turning everything on its head. But I've spent a decade looking at this, Peter, and I can back it up. So seed oils, that was why they were supposed to be beneficial.
Yeah.
But actually they're pro-inflammatory, certainly when they're cooked, and they cause inflammation, and have certainly been linked to dementia and cancer. So absolutely to be avoided, 100%. 100%.
It seems to me we've got ourselves in a crazy place whereby... Well, I mean, you said it's corporate capture. It's the people who are making the money from the drugs and the food and the influence they're having on government, which is preventing proper regulation around these
and progress. We're not progressing as a society. It's stifling innovation
and education.
Yeah, because it starts from flawed science, and science evolves, and then industry exploits flawed science. And by the time that someone's figured out it's flawed, they've got such a strong stranglehold on selling you certain foods, low-fat foods, etc., certain drugs that people take, that it then becomes difficult to overcome quickly. It has to be overcome because we won't make progress.
And low-fat foods
takes time.
Bad themselves?
Well, not necessarily. Anything marked as low-fat is ultra-processed and should be avoided. Yeah.
Yes.
Basically.
So should you have a Coke instead of a Coke Zero?
No, I don't think so. No, sugar is really, really bad.
How bad is sugar?
Well, just like one cigarette won't kill you, neither will 1 teaspoon of sugar. But over time, chronically eating sugar is going to cause inflammation in the body. It raises glucose and insulin, increases blood's clotting ability, and inhibits the blood's ability to deal with blood clots as well. That's even just one, sugary meal can do that. Now, of course, that doesn't necessarily mean it's going to cause harm, but we see from studies in labs that this is what happens. So, yeah, I mean, how bad is sugar?
It feels like we need our...
Listen, as an occasional treat, if you were having a dessert once a week and having no other sugar in your diet, probably not going to cause you a problem. If you're having sugary food 2 to 3 times a day, big problem.
Well, I mean, I used to.
Yeah, so did I. Yeah, I'm a reformed sugar addict, so I empathize.
It feels like we need our equivalent of the Trump Avengers team here in the UK, a group of people with influence and power.
Yeah.
And platforms to be able to communicate this out and drive radical change, because there are nudge units within government to nudge us towards things that they want us to do.
Yeah.
But we have this degradation of society at every level, I believe, every level. And I mean, ultimately, the NHS itself would benefit from having us be a more healthy nation.
100%. I mean, that's where most of my focus with all my publications, academic work over the last 10 years on food, on Big Pharma, has been directed towards the NHS, sorting the NHS out. But we've had some successes. But yeah, we could very quickly transform the NHS to improve quality and at lower cost within a very short space of time by removing a lot of unnecessary treatments, unnecessary procedures, introduce a lifestyle stuff. It's not rocket science to train doctors up or medical students. I learned this myself after graduation. Very simple, very, very simple. Surely they could literally learn in less than a day what they need to do for their patients and what they need to advise.
But surely that this should be an easily open door for you to push through.
No, well,
what's the block? Is it back to the corporate capture?
At Ledden, we built the best Bitcoin-backed loan platform in the world. Proven, trusted, growing. Ledden's proven track record speaks for itself. Visit ledden.io/Mr. Obnoxious to get started. Ledden, there is no second best. Ledden is not regulated in the United Kingdom. Any credit products or virtual asset services provided by Ledden are not subject to UK regulatory protections. Please consider the risks associated with virtual assets and consult a financial advisor before making any decisions.
The evidence alone isn't enough. The medical science isn't enough. Opposition from powerful vested interests needs to be overcome. Okay. So one of the lessons in public health advocacy is as soon as your work threatens an industry or an ideological cabal, you will be attacked, sometimes unrelentingly and viciously. So in every moment where I've got stuff in the mainstream, there has been pushback. Even involving Public Health England. His chief executive called up hospitals to try and stop me speaking when I produced a book which became an international bestseller, saying that essentially the dietary guidelines are wrong. We need to get the carbohydrates minimized. I was endorsed by the chair of the Medical Royal Colleges. It was endorsed by Andy Burnham, former Secretary for Health. He actually tried to get them to basically dissociate themselves from me and embarrass me, but they didn't. And then it was exposed in a Sunday Times article by John Unger Thomas, who's now who works for The Guardian. And it was, the title was something like, Tom Watson, the deputy leader of the Labour Party, lost 100 pounds following my advice. And it was something like, Watson's diet doctor hit by government dirty tricks campaign. That was the title, that was the article story on me. in 2016, 17. You can probably find it if you look it up.
Yeah. What happened to him then?
Well, he did well. He lost weight, and then he's no longer.
No, the guy who attacked you from the.
Oh well, nothing.
But this is
Nothing happened to him. And then I met the chief nutritionist of Public Health England, I think afterwards, by chance. And we'd been at loggerheads in the media around this dietary guideline stuff. And I sat with her, and it was a very polite conversation. And in fact, she said, I lost my mum in 2018. In fact, it's a 5-year anniversary of her passing today. And she was telling me, giving me her condolences and everything. And I chat with her, very cordial. And I said, Alison, her name's Alison. I said, why have you got on the so-called healthy eating guide of the UK, the Eat Well plate? Why is there junk food on there? Why are there crisps and chocolates and all that kind of stuff? And her answer was this: you've got to understand, Aseem, one of the biggest contributors to our economy is the food industry. Not it shouldn't be on there as a healthy eating guide. That was her answer.
But they're attacking the food industry at the moment with the farmers.
Right. Yeah. So.
It's all very concerning. Oh, here we go. Tom Watson's diet doctor hit by government dirty tricks.
Yeah, you can, cardiologists, yeah. You can.
A cardiologist and anti-sugar campaigner whose advice helped Labour's deputy leader Tom Watson lose 7 stone, says victim of dirty tricks. That's fine though.
So that was 2018, yeah.
What's the impact when they come after you? What is it? What's the experience of that like?
Mixed feelings. To some degree, you got to grow thick skin as well. You got to grow a rhinoceros hide because, if you're having impact, you're going to get attacked. So for me, it's a sign of impact. But on a personal level, yeah, it can be stressful for a short period of time. But then I pick myself up and carry on. I've taken a lot of hits, but that's a marker of that you grow from that. You become stronger. You find that more people come to your defense and support you because they see the injustice of what's happening. Sure,
I just don't understand how these people can fight against good, honest information for lining their own pockets. I've never understood it. How much of a moral...
It's not as simple as that as well. I think it's a lot of people in this situation psychologically get indoctrinated into a way of thinking. And changing one's mind is not an easy thing to do. Jordan Peterson, the clinical psychologist, very famous, says that changing one's mind is one of the hardest emotional things that people can go through. John Kenneth Galbraith, the Canadian-American economist, says, faced with the choice between changing one's mind and proving there's no reason to do so, almost everybody gets busy on the proof. So that there's a psychological barrier there too, but it's exacerbated or worsened by the financial power of these corporations that profit from lies, essentially.
Yeah, it should be criminal.
Yeah,
if we are putting people in jail for tweets, which some of them are offensive and horrible.
Let's put it this way: if I get into any kind of position of power in the world in any time soon, then I will definitely make sure that that's what happens. Donald Trump, of all people, is very interesting. Having been someone that I believed was very much in line with Milton Friedman's approach, said in a speech recently, and I think he also said it on Rogan podcast, he says, if we find that Big Pharma have been putting profits before patients, which is what Milton Friedman advocated for, they will be held accountable. Right?
Mm-hmm.
Big U-turn there, which is great.
Yeah. You talked earlier about metabolic health.
Yeah.
As a 46-year-old who's had drug problems, likes a drink, historically smoked, not always been as healthy, but starting to think, shit, I should get healthy. And there'll be lots of people like me. As a cardiologist, what would your advice be? Yeah, so listen, lifestyle. The great news is you can improve those metabolic health parameters very, very quickly. I'm doing this with lots of patients, but I recently just started, a bit of a plug here, a program called Metabolic Reset with a brilliant nutritionist called Kim Pearson. And we did it as a pilot for the first 4 weeks first. And we wanted to show people that in 4 weeks you can improve blood pressure, get your weight down, improve your cholesterol profile, etc. And they've all, the people that have adhered to the plan, it does work.
very straightforward. The single most important thing, and this is just purely a diet plan, by the way, it's not about exercise or anything else. The single most effective way to rapidly improve metabolic health is basically cut the carbs, the starch and the sugar.
Just get rid of them. I can do that.
Go cold turkey. And listen, once you get to a baseline and you're happy with it, I then say adopt the 80-20 rule. If you still want to have a biryani on the weekend and a sourdough pizza or whatever else, go for it and don't worry about it, as long as 80% of the time you're following the diet plan.
Okay. What else?
Well, listen.
Or I should do the plan. How do I do the plan?
Other things. Well, you can get it's in all my books. I mean, in fact, the latest book I wrote for me is probably the best, most concise one. Oh, there you go. Metabolic Reset.
That's a nice book.
So we're actually starting, we're actually evolving into something a bit bigger now. We've done the pilot. It's gone really well. And we're going to launch probably in the new year and do a really sort of 12-week program with because people like education. So we want people to be so empowered by what they get from the program that they also become experts, and then they can help other people and their family members. And it's not difficult, honestly. It's not rocket science. And they'll be thinking, wow, and they'll understand their body, they'll understand why, what foods to eat, they'll be able to educate, so we want this to be, much bigger, but it's all explained in my books. But the third book I wrote, which is quite concise and my favorite of the three, is called A Statin-Free Life. How to prevent, manage, potentially reverse heart disease without the use of medications. And it's all in there.
But this metabolic reset would be fantastic for the NHS. I mean, we know it's struggling. We know the waiting lists are high. We know 100%. The range of conditions.
It's a lot easier than people think. And it's not expensive. Well, to some degree, let's not ignore the fact that a lot of what drives ill health, Peter, is what we call the social determinants of health. So estimates says 35 to 50% of what determines your health is actually that. And just to define that, these are the conditions in which we are born, grow, live, work, and age, and the drivers of those conditions. So everything really starts from childhood in a way. And we know there's data now showing that, for example, if you have severe psychological trauma or you don't have a nurturing parent, that will set you up for disease later on. So we've got to think about how do we restructure to some degree society in a way that allows everybody to be their best version of themselves and flourish. I think, isn't that a noble aim? Who would disagree with that?
I mean, I just don't understand why anyone would disagree.
Well, the people that may be barriers to that are the super elite rich who have got more and more wealth and power and are now in a situation where they falsely believe to some degree that they've got their wealth and power by their hard work and their intelligence, etc., and therefore are maybe better than everybody else. And because of that, they want to then control what everyone else does because they think what's best for us. And this is why you get this censorship going on. This so-called, this freedom of speech suppression is actually rooted in this behavior. And it actually comes from colonialism, right? So British colonialism, has evolved into American imperialism. That is now a situation where that's all disappeared, where it's not about, that came from a mindset that there are certain races or people had better breeding, better science, better knowledge, okay? And that's where, obviously, you had the British Empire. But what's happened now, that has now evolved into a corporate colonialism, which is no longer across borders, Peter, it's within borders. And who are the people who are being affected the most? The middle classes. And the people from low socioeconomic backgrounds who are being exploited by these big, powerful corporations and a super rich elite who have got to those positions, Peter, I've got to say, not from merit, but from being part of a corrupted system and therefore from fraud. They don't even deserve it. And then you have this meritocracy mindset that gets in there, that I've got to this position because I've worked really hard and all these other people, they create this propaganda that makes a lot of people believe that the have-nots are there because it's their own fault.
I think this is why we...
Does that make sense?
No, it does. And
So we need to really unravel and get to the roots of the issue. And that's where we are. And once we get there, then we can start, once it's exposed and it's understood, when it's revealed, it then becomes known. Once it becomes known, it can no longer continue. Because for it to continue, the system to continue, people have to be compliant with it.
But you have to almost check yourself a little bit at that point and say,
you do.
Hold on,
yeah,
what am I doing?
Exactly.
Have I had that belief of myself?
Well, of course. But that, we've corporatized human beings as well and our mindset. And this also comes back to a materialistic mindset where we place more value on goods and objects and hedonic experiences than we do on each other, on human beings and relationships. And that is contrary to what it means to be human. So actually, to understand the problem and to get to a place, it actually starts we come back to, what does it actually mean to be human?
It's almost like
because it causes internal suffering, and that's why we are in many ways. We've got mental health problems going up. We've got disillusionment. We've got people with lack of meaning, lack of purpose. We're less connected, made worse during the pandemic. It's all got exacerbated. But now I think we're reaching a tipping point where, whatever we do next can take us to complete oblivion. We could be on the verge of World War III. Or we can steer the ship towards utopia. And actually, for me, the re-election of Donald Trump as president of the United States, for whatever his vices, I think is one of the most important moments in the last few decades to happen in the world. You know why? Primarily because he is a disruptor.
Yeah.
And we need the system to be disrupted. And he's got a team of people around. Some of them, people I know. One of them I would consider a friend, Robert Kennedy Jr.
Yeah.
He's appointed Jay Bhattacharya to the head of the NIH. I know Jay very well. I think we're in a potentially revolutionary moment.
Well, it's an interesting populist revolt, because even the term populism itself has been used as a pejorative, and I think it's to try and discredit people who are actually considering, the plebs of the world, who have been marginalized, who've been gradually made poorer, more unhealthy, ignored, treated with utter contempt by the media, the politicians, to the point where it's weird, because I see the election of Donald Trump exactly like you, for all his things that you can criticize him for. The way he's talking, the people who's appointed him, he's looking to actually drain the swamp this time.
He is.
And I think he learned the mistakes of his appointments from the previous time. For sure. And he's gone outside of the establishment.
Completely.
A little bit. I mean, look, Tulsi was ejected from the establishment. Yeah. RFK was ejected from the establishment. Could have won the election as the Democrat nominee, which, by the way, I think in hindsight, he'll realize this was the best scenario.
Of course.
And then we have, feels like 80% of the country believe that Donald Trump he is the second coming of Hitler as a Nazi. But everyone I know is sat here thinking, how do we have the same here in the UK? Because we had a terrible Conservative government, which has been followed by a terrible Labour government. And I think everyone is crying. Well, a lot of people are crying out for something different here.
Yeah.
They know something's wrong. They're getting poorer. They're more fed up. They're, like you say, we're getting more unhealthy. There's more depression. I'm here for a populist revolt. I'm here for a complete reset of the entire system. A complete reset. Just don't know who our Trump and Elon are. I know our RFK is.
I think, Britain tends to follow in America's footsteps. Yeah. I think if things start to really change in America, I think it will have a ripple effect across the rest of the world. And that's why, for me, I focus a lot of attention. I made this film first in a farm. I went to the States, originally with the background of helping, being a film that would have maybe help support Robert Kennedy Jr. to get into office. Obviously, the situation changed a bit, but it's for me, I could see that this was the way. So that's where I devoted a lot of my attention there.
I had Dan Wharton in here earlier. I was talking to Dan, and I said to him, I'm very pessimistic, but also very optimistic at the same time. Yeah. I have a very pessimistic short-term outlook, but I have a very optimistic long-term outlook that we will fix this, because I think the decentralization of media...
We have no choice but to fix it, Peter, do we, as well?
But I think truth is... I think it's getting harder to lie. And I think it's getting harder to con the public with these lies. I think we all recognize we've been stuck in a system, a cycle of endless wars, lies, bullshit, corruption, theft, government incompetence. And I think people are just, I think the breaking point here was essentially a two-party system. Well, I can't vote for Conservatives. They've been so terrible. I'm going to vote for Labour, income Labour. And it's like, oh God, this is equally shit. We need something else.
Yeah.
And I think what's going to happen over the next 4 years is that there's going to be a burning desire for something new and different. I just don't know where it comes from. But I'm hopeful.
Yeah, absolutely. I I think what's interesting as well, we've observed this inversion politically, where the left was traditionally anti-war, pro-free speech, anti-corporation. Complete opposite. So I call them, they're not the left, they're the fake left.
Yeah.
They shouldn't be called the left. And one of the things, again, we need to address, and I think this is willful blindness, right? Ideological willful blindness, is people think this is a form of communism. No, there are certain things that may sound communist, but it's actually the people really pulling the strings with the power of the big corporations.
Corporatism, yeah.
In communism, if it was being implemented, one of the most important result of communism is reduction in economic and social inequalities. And it's been going the opposite direction. Under previous Labour government, under the Biden administration, 12 out of 16 years were Democrats in power, went the opposite way. So this is nothing to do, it's the opposite of communism. The only thing that I think has got a lot of attention, understandably, and I think needs to be called out, is the identity politics going, to an area where it should never have gone,
But it's failed.
Yeah.
The identity politics has failed. Yeah. No one wants this shit anymore. That doesn't worry me so much anymore.
Yeah.
The only thing
but the identity politics has been exploited by the corporations as well.
Of course it has.
That's what it is. Big Pharma are the ones that benefit most from this whole transgender discussion and debate, to widen the potential use of drugs for, teenagers or kids that are, to get them to transition, whatever else. This is all, again, they're the ones who've fueled the PR behind it and created this whole narrative.
I think it was the straw that broke the camel's back. I think that's the point where everyone said, I've had enough of this shit.
Yeah.
I think it's
also the left
failed.
don't realize they've been exploited by the corporations. So again, it comes back to the real tyranny right now in the world is corporate tyranny, and that's what needs to be addressed head on. Until we do that, we ain't going nowhere.
It's Friday night. Soho's getting pretty noisy. I could talk to you for hours, and I would like to follow up at some point. I'm going to go away. I'm going to do my research on corporate tyranny. I'm going to go and think about this a lot more. I'm going to go and read The Corporation.
It's a brilliant book, and watch the documentary.
Yeah.
And in fact, actually, on that, just very quickly, Peter, the diagnosis given to the corporation, because I'm a diagnostician primarily. What doctors are usually very good at being diagnosticians, okay? Not so good with the COVID vaccine, but they'll get there. But everything else, very good at. And the diagnosis given by the forensic psychologist behind the original definition of psychopath is that big corporations as legal entities, not the people in them, although I'm sure some of them are, fulfill all the criteria for psychopathy. So I came up with this new term called, we talk about social determinants of health, there's something called commercial determinants of health. I came up with this term called the psychopathic determinants of health. And I gave this in a lecture, and Richard Horton, the editor of The Lancet, was there, and he referenced it and wrote an article about my lecture and said that he's produced a new term called psychopathic determinants of health. So that is at the root of the problem. The downstream effect is a corporatization of human beings.
We have psychopathic corporations.
Yeah. Yeah.
Oh, man.
Oh, yeah. It's listen, just to give you an example, when it's highly likely now that when Pfizer knew the vaccine wasn't stopping transmission, it was certainly happening in popular, people were realizing that's when they pushed for the mandate. So think about that. So when they, and historically from big tobacco documents, when corporations know their product is harmful, they will then spend money marketing it as being the opposite.
But that's psychopathic.
It's
evil.
Yeah.
These people should be in fucking jail.
Well, but this is how they exploit the system. So that's why you need, listen, who else is going to do it other than government to sort it out?
Yeah.
To say this is illegal. Like if you look at any big revolution that's happened historically, it's happened through changes in the law. Women's right to vote, abolition of slavery, seatbelts in cars, good things that have happened, public smoking bans. It has to have legal, regulation has become a dirty word, but it shouldn't be. I'm all for freedom of expression. People should be free to do as they please as long as they are not hurting others. Okay, I think most people would agree with that.
I think so.
So what we need deregulation of people to express themselves, but we need regulation of the very people. So what we are doing,
deregulation of people. I haven't heard it fixed.
Yeah, but I think that's how the narrative should change, because deregulating corporations is actually inhibiting our freedom And it's a form of oppression where our speech is being inhibited. We are being coerced or mandated to take drugs. So that's what we are, by regulating corporations, we are increasing personal freedom. That's why the narrative needs to change, because they're the ones behind the narrative that's made regulation a dirty word, because it allows them to have more power and more tyranny. So if you want to get to the roots of, well, hold on, where's this narrative come from, deregulation? It all goes back to the corporation.
I mean, you've blown my mind, Aseem.
Tell me if that doesn't make, it makes sense.
No,
doesn't it?
But actually the idea, I mean, I've been having the debate about free speech with some of my lefty friends. And I've struggled to get this idea to them that we need free expression to be able to discuss ideas. We need to be able to think freely. We need to be able to challenge ideas.
100%.
But the deregulation of people, I think it's just a genius way of putting it.
Yeah. And another way, I'll just finish on one of the points, the free market, which sounds great in concept and is according to, Adam Smith principles, has actually become a freedom to deceive, freedom to exploit, freedom to manipulate, and freedom to dominate market by big corporations.
But I mean, the thing about free market principles, a lot of them were developed before we lived in a hyper-globalized world with technology, the way we have it now, e-commerce, and the ability for companies to grow so big. The free market ideas, they came originally back from barter days, free trade.
Yeah.
Maybe ships going around. We live in a very different world now.
Very true. And also, it was always felt that the invisible hand of the market would then correct itself.
Yeah.
But the problem is that only happens when you've got knowledge. But that knowledge, the so-called invisible hand, isn't happening because we are being gaslighted. So, for example, with the COVID vaccine, we know that it's causing all these serious harms, and then they will develop a PR campaign to blame all of this on COVID, or you're exercising too much, or you're spending too much time in the sun. All these articles coming out. This is, again, deliberate distraction. So the invisible hand of the market can't function.
Going to the gym
when they're controlling the hand. They are actually controlling the hand.
Oh, man. See, I've got a lot to think about here. It's I never rewatch my shows because I hate looking at myself, but I'm going to need to go back and watch this and think a lot about this, because there's certain things that trigger a mission in life.
Yeah.
And with everything you're saying, I mean, I'm not naive. I'm aware of corporate capture. I'm aware of corporatism. I'm aware of Big Pharma and other big industries. I am aware, but I hadn't linked everything together in the way that you had done so for the collective good of our nation and health of our nation. I don't know. I'm not articulating myself. Well, I just need to go away and have a think. Oh man. Listen. Thank you. I want to do this again, and probably sooner than I should ask. But where do you want to send anyone after this?
Listen. I'm on social media. I'm quite active on X, Dr. Aseem Malhotra, on Instagram, Lifestyle Medicine Doctor. That's where people can see stuff. I think the best way for people to really get to grips with this issue in a relatively quick time is probably to go to watch my documentary film, which I just co-produced, called First to No Farm. And the website is nofarmfilm.com. So NOPHARM film, or one word, .com. And you can download the film for whatever, I don't know, £6-7.
Right. So I watched this weekend, Con.
But that, I think, it covers, and it's some very, eminent, respectable people, experts in their field. You put it all together. But also there's hope. There's a lifestyle thing in there, etc., as well as exposing how Big Pharma have captured medicine.
Powerful enemies, man.
So but I don't take it. I don't see this as a personal thing. I honestly see myself as just a medium for a message. That's all. So I don't, I'm not worried in that sense, because I'm out there. My publications are out there. The message is out there. People come up to me not infrequently saying they're worried about my life. I'm going to get killed. I'm not worried about that at all.
Well, good. We're going to need you, man.
Well, partly also because in their shoes, and this is what they do, it's better for them to discredit me than to kill me, because they make a martyr out of me if they kill me.
Yeah.
And that's what they've been trying to do. And they've been doing to some degree successfully. The smearing, anti-vaxxer, whatever, all sorts of stuff. The smearing works, unfortunately. It does, but you just got to just...
But only for so long. They tried to smear Trump out of an election, and it backfired.
Sure.
The reverse happened. I think a large part of the American public saw behind the veil, and they realized, like, hold on a fucking second.
Yeah.
And I think that's, like I say, that's the decentralization of media and news. What the public aren't stupid.
Yeah, I think that's been one. I agree. I think that legacy media losing trust, losing viewership, people looking to alternative media, I think definitely is a good thing to some degree. But at the same time, losing trust in our institutions is a recipe for chaos, but we might have to go through more chaos before we're able to transform the system.
Yeah.
Ideally, we don't want that situation. You need to trust government. If you don't trust government, complete anarchy and chaos. So we need the government to actually, they need to step up as well. Everybody needs to step up.
Thank you, man. Thank you so much. A lot to think about.
Thank you, Pierre.
Thank you to everyone listening.
Appreciate it.